We're going to talk about the knee ligaments, which are dynamic stabilizers for this joint. So as a reminder, this joint is a hinge joint. So it is doing knee flexion and knee extension. Extension is when it's straight, flexion is when it's bent. This is only moving in the sagittal plane. So when we talk about stabilization, typically with the knee, we're going to talk about we need stabilizers to stabilize against anterior force, posterior force, medial force, and lateral force. Pretty straightforward and simple, although it can get complex when we have those rotational forces or combined forces. So like an anterior medial force, so a force coming from that side. So let's just talk about the knee and how it's set up. So what we don't want to forget is that there's another leg that is on this side protecting the medial side of the leg in most of our function. If you ever get confused if we're on the medial or lateral side, find the fibula, and the fibula bone is going to be the lateral side or the outside of our knee. So when we talk about the inside versus the outside, if you look, the body is always so smart and well designed. So this MCL ligament on the medial side is going to be much thicker. It's actually even wider and thicker, and it's part of the capsule and actually attaches here to the medial meniscus. So it's really strong. It's on the medial side where we're more likely then to take a force. So being very vulnerable here, there's no other body part out on the outside. So like in football is a common sport, and the linemen, people fall into them. And that's why if you look at the football linemen on TV, most of them are wearing braces. I think all of them will be wearing a brace that's supporting the medial side and protecting it and protecting this MCL because of that. So your outside, your lateral force will create medial instability. So your MCL is going to stabilize against lateral force, where your LCL is supposed to actually support against medial force. A couple of things. One, we don't get a lot of medial force that's direct contact because there is another leg here. So you can, if your leg like lunging out and things like that, but it's just not as common as like a lateral force. And so we have a very skinny LCL. And in fact, it makes it look really simple with this model, but it's not that simple because you have all this musculature around it as well. So you have an LCL. You also have lots of small little teeny ligaments that have to do with the fibula here and the posterior knee. And then you also have a popliteus muscle that comes around as well. And so all of that kind of stabilizes this whole posterior lateral corner. So PLC, sometimes it's referred to, the posterior lateral corner, and that is affected when there is a anterior medial force. So some kind of force coming from this front medial side and hits the leg, and it is stabilized back here at the posterior lateral corner. So in fact, the LCL is not just straight lateral and would only take a medial force like it looks on a model. In fact, it has to have some kind of rotational force. This LCL is rarely torn by itself. It almost always is torn with the PCL or torn with these other structures of the posterior lateral corner, which are smaller ligaments. It's also very overlooked because these ligaments and things are so small, and that popliteus muscle is a muscle. And so you really sometimes have to go to a multi-ligament specialist to really identify this, but this is a common injury to go long periods of time without ever being assessed. Now, getting to the more common ligaments, we have our ACL and our PCL. So I know when we refer to knee ligaments, we have MCL, medial collateral ligament, and lateral collateral ligament, LCL. Remember that L at the end is always ligament, but the C in the middle is different. So the first letter is telling you where it's located. So MCL, medial collateral ligament, LCL, lateral collateral ligament. But then when we get to ACL and PCL, it's anterior versus posterior, but it's cruciate. And so they are crucial to the stability of the knee because they are in the central part. So when we look, the anterior is starting on the anterior side of the tibia, and then it runs to the posterior side of the femur, and then the PCL runs from the posterior tibia to the posterior femur, and they cross each other. The ACL is preventing anterior translation. So ACL is anterior cruciate ligament, and it prevents anterior translation of the tibia. So it's both anterior there. And then PCL is preventing posterior translation. Just from functionality and our muscles and how the knee is shaped and designed with this socket, with the meniscus making a little bit deeper of a socket, and our function and having our really powerful quads on the front here, it's more likely for the leg to go forward. That also has to do with dynamic valgus collapse, which I talk about in the module. So make sure you read that and look in that. And that will also come up when I talk about the injury spotlight on the unhappy triad. So just know that there are 4 main ligaments that you're going to memorize for this class. Understand what they stand for with medial and lateral collateral ligaments, and then the cruciate ligaments, and understand what they are stabilizing in the knee. And if you have any questions, reach out.